His wife said he looked peaceful. She reached over to wake him at 6 in the morning, the way she always had for 41 years of marriage. He did not respond. His hands were cold. His face was still. There had been no warning the night before. No chest pain, no breathlessness, no sign at all that anything was wrong. He simply went to sleep and never came back. And when the cardiologist explained what had killed him, his wife broke down, not just from grief, but from recognition. Because she had done the same things he had done that night, she was still doing them. And the thought that she might have been next was more than she could bear. I am sharing this with you today because what happened to him is happening in bedrooms across this country every single night. Not because of some rare genetic condition, not because of a disease nobody knew about, but because of ordinary habits, things that seem completely harmless, that quietly turn the hours you sleep into the most dangerous hours of your entire day. I'm Dr. Alan Miller, and after 18 years treating cardiovascular risk in older adults, I've seen firsthand what happens when these warning signs go ignored. Today, I'm going to show you 5 nighttime habits that are silently increasing your risk of a heart attack or stroke while you sleep. Some of them you are almost certainly doing right now. And what makes them so dangerous is not how dramatic they sound. It is how completely normal they seem. By the time this video ends, you will know exactly what to stop, what to change, and what to do tonight, starting tonight, to make the hours you sleep genuinely protective instead of quietly deadly. I need to warn you about number 2 on this list in particular. It is the one that surprises my patients most. It is the one nobody ever suspects. So please stay with me all the way through. Here is what most people do not understand about the cardiovascular system and sleep. Your heart does not simply rest while you sleep. It goes through a carefully regulated cycle of recovery, repair, and adjustment. Your blood pressure naturally drops during the early hours of sleep. Doctors call this nocturnal dipping. And this drop is essential. It gives your heart a window to recover from the stress of the day. It allows the lining of your blood vessels to repair itself. It reduces the workload on your kidneys. But here is the problem. Several common nighttime habits disrupt this process completely. They either prevent that blood pressure dip from happening, or they cause your blood pressure to spike sharply during the night. They thicken your blood. They strain your heart rhythm. And they do all of this while you are unconscious and cannot feel any of it happening. The average doctor's appointment runs 12 to 15 minutes. There is simply not enough time to walk through every nighttime cardiovascular risk factor in detail. And most patients never think to ask. So these habits go uncorrected for years, decades in some cases, until one night the body cannot compensate any longer. That is what I am here to change today. Habit number 5. Eating a heavy or salty meal within 2 hours of bedtime. I want you to think about what happens inside your body when you eat a large meal in the evening, particularly one that is high in sodium. The process of digestion requires significant blood flow. Your digestive system pulls circulation away from other areas to process that food. At the same time, the sodium in that meal begins drawing fluid into your bloodstream, raising your blood volume and with it, your blood pressure. Under normal circumstances, your blood pressure should begin to fall as you drift towards sleep. But when you have eaten heavily or consumed a high-sodium meal within 2 hours of bedtime, that descent never happens properly. Instead, your blood pressure either stays elevated throughout the night or continues to climb, a pattern called non-dipping hypertension. Research has consistently shown that non-dippers face dramatically higher rates of heart attack, stroke, and cardiovascular mortality than people whose blood pressure follows its natural nocturnal curve. I treated a gentleman named Robert, 68 years old, a passionate home cook. He loved a large dinner, pasta, cured meats, fresh bread. He would eat at 8 in the evening and be in bed by 9. His daytime blood pressure readings were perfectly controlled on medication. But when I ordered a 24-hour ambulatory blood pressure monitor, a device that records blood pressure continuously through the night, his nighttime numbers were alarming. His pressure never dipped. It climbed steadily from 10 p.m. through 3 in the morning. We changed just one thing, his dinner time. He moved his main meal to 5:30 in the evening and had only a light, low-sodium snack if he was hungry later. Within 6 weeks, his nighttime readings had normalized completely. He told me he slept more deeply than he had in a decade. A heavy, salty dinner is not a small indulgence. In someone over 55, it can quietly keep your entire cardiovascular system under dangerous pressure for the whole night. Stay with me, because habit number 4 surprises almost everyone who hears it for the first time. Habit number 4. Sleeping in a room that is too warm. This one catches my patients off guard every single time. Most older adults prefer warmth. They pile on blankets. They run space heaters in the corner of the bedroom. And I completely understand. Cold can be genuinely uncomfortable, particularly for people managing circulation issues, arthritis, or peripheral neuropathy. But when your sleeping environment is too warm, a quiet cascade of cardiovascular consequences begins that most people never connect to their heart. As your core body temperature rises during sleep in an overheated room, your heart is forced to work harder to dissipate that excess heat. Blood is redirected toward the skin's surface. Your heart rate climbs. Your blood vessels near the skin dilate. But internally, your blood becomes more concentrated as you lose fluid through perspiration. That concentration, a mild but very real form of overnight dehydration, thickens your blood. Thicker blood is slower blood, and slower blood is far more prone to clotting, particularly during those long, still hours when you are lying motionless. The ideal sleeping temperature for cardiovascular health sits between 60 and 67 degrees Fahrenheit. I understand that sounds cool, but your body is designed to sleep in that range. It is the temperature at which your core body temperature naturally drops to initiate and sustain deep, restorative sleep. It is the temperature at which your heart performs its most efficient repair work overnight. If your bedroom regularly exceeds 70 degrees while you sleep, I want you to take that seriously. A simple thermostat adjustment, or sleeping with one fewer blanket, can make a measurable difference in your cardiovascular health every single night. What comes next is where I need your full attention. Number 3 is the one people argue with me about most, but the research does not argue back. Habit number 3, drinking alcohol before bed. I want to be very direct with you here. I understand that for many people, a glass of wine or a small drink in the evening feels like a ritual. It feels relaxing. It feels earned. And for many years, there was a cultural belief, even some medical support, for the idea that moderate drinking was harmless or even beneficial. The science has moved on, and what we now know about alcohol and the sleeping cardiovascular system cannot be unsaid. Alcohol disrupts the electrical system of your heart. In the hours after drinking, even a moderate amount, the risk of developing an abnormal heart rhythm, a condition called atrial fibrillation, increases significantly. Atrial fibrillation causes the upper chambers of the heart to quiver erratically instead of contracting in coordinated rhythm. When that happens, blood can pool inside the heart and form clots. Those clots can travel through the bloodstream to the brain. And when a clot reaches the brain, it causes a stroke. Beyond the rhythm disruption, alcohol also prevents your blood pressure from performing that essential nocturnal dip. Alcohol metabolizes slowly. Its effects on your blood vessels and autonomic nervous system persist for 4 to 6 hours after your last drink. So when you drink at 9 in the evening and go to bed at 10, your cardiovascular system spends virtually the entire night under low-level stress. Elevated pressure, disrupted rhythm, impaired vascular repair, all while you feel nothing but sleep. Let me tell you about Margaret. 71 years old, a retired school teacher, sharp as anyone I have ever treated. She came to me after her second episode of nocturnal heart palpitations, episodes that always seem to happen in the middle of the night. She did not drink heavily, never more than 1 glass of red wine with dinner. But dinner was at 7, and she was in bed by 9. When I walked her through the timeline and explained exactly what was happening inside her heart during those nighttime hours, she was genuinely stunned. She stopped the evening wine entirely. Her nocturnal palpitations disappeared within 2 months. Her sleep quality improved dramatically. I am not here to take away the pleasure of your life, but I need you to understand what a pre-bedtime drink is doing inside your cardiovascular system while you sleep. If you are over 60 and you are consuming alcohol within 3 hours of bedtime, this is something worth discussing with your doctor. Please always talk to your physician before changing any medications or prescribed routines. That conversation is not a replacement for what I am sharing with you today, and what I am sharing is not a replacement for that relationship. Now we come to the 2 habits I consider the most dangerous of all. And number 2 is the one that almost no one, not even people who watch health content regularly, connects to their heart. Habit number 2, going to bed dehydrated without drinking water first. Your blood has a consistency. When you are well hydrated, it flows smoothly and efficiently through your vessels, carries oxygen reliably to every organ, and passes through the chambers of your heart without excessive resistance. But when you are even mildly dehydrated, that consistency changes. Your blood becomes more viscous, thicker, stickier, slower, and it must be pushed through your vessels with greater force. Now consider what happens during sleep. You are not drinking. Your body continues losing fluid through the simple act of breathing. Each exhaled breath carries water vapor out of the body. You lose fluid through gentle perspiration. A typical adult loses somewhere between 1 and 2 cups of water overnight through respiration alone. If you go to bed already mildly dehydrated, which many older adults unknowingly are, because the sensation of thirst diminishes significantly with age, then by 3 or 4 in the morning, your blood can be thick enough to form small, dangerous clots. This is one of the primary reasons that heart attacks and strokes happen most frequently in the early morning hours, between 3 and 6 a.m. It is not a coincidence. It is blood viscosity. It is a cardiovascular system struggling to push blood that has become too thick to move efficiently through vessels that have already been under pressure all night. I saw this firsthand with James, 74 years old, an active man who walked 2 miles most mornings and seemed in remarkable health for his age. He had a minor ischemic stroke at 4:30 in the morning. When I reviewed his daily habits, there was no dramatic red flag. His diet was reasonable. He did not smoke. He was on appropriate medication. But when I asked about his fluid intake in the evening, he told me something I hear far too often. He deliberately stopped drinking water after 7 p.m. because he did not want to wake up in the middle of the night to use the bathroom. He was rationing his water. And in doing so, he was quietly setting the stage for exactly the kind of event that occurred. A small glass of water, roughly 4 to 6 ounces, immediately before bed is not enough fluid to disrupt your sleep with nighttime bathroom trips. But it is enough to meaningfully reduce the overnight thickening of your blood during those critical early morning hours when clot risk is at its peak. This one habit, practiced consistently, could be one of the most protective things you do for your heart every single night. And now we arrive at number 1, the most silent, the most dangerous, the most consistently underestimated cardiovascular risk I have encountered in 18 years of clinical practice. And I believe, with very strong reason, that it is what killed the man whose story I opened with today. Habit number 1, sleeping on your back with undiagnosed or untreated sleep apnea. Sleep apnea is a condition in which the airway repeatedly collapses during sleep, causing breathing to stop, sometimes dozens, sometimes hundreds of times per night. Each time breathing stops, your blood oxygen level drops. Each time your oxygen drops, your brain registers a crisis and triggers a stress response. That response floods your body with adrenaline. Your blood pressure spikes sharply. Your heart rate surges. Your blood vessels constrict. And then breathing resumes. The crisis temporarily passes, and the cycle begins again, over and over, all night long, while you feel absolutely nothing. The vast majority of people with sleep apnea do not know they have it. They do not feel themselves waking. They do not remember gasping. They do not sense the dozens of micro-arousals their brain experiences every hour. What they feel is simply tired. A persistent, bone-deep fatigue that they attribute to aging, to stress, to the demands of their day. And because they attribute it to aging, they never pursue answers, never get tested, never get treated, and the damage accumulates, night after night, year after year. Here is what untreated sleep apnea does to your heart over time. The repeated oxygen drops cause the walls of the heart to thicken and stiffen. They trigger chronic inflammation throughout the blood vessels. They create conditions perfectly suited for the development of high blood pressure that is resistant to medication, atrial fibrillation, coronary artery disease, heart failure, and stroke. People with severe untreated sleep apnea have cardiovascular mortality rates that are profoundly elevated compared to their peers, and most of them have no idea why. Sleeping on your back makes every one of these effects dramatically worse. The tongue and soft tissues of the throat fall backward under gravity when you lie flat, compressing the airway further and making obstruction far more frequent and severe. Something as simple as changing your sleep position, sleeping consistently on your side rather than your back, can reduce the frequency and severity of apnea episodes by 50% or more in many individuals. A pillow positioned behind your lower back can help prevent rolling over during the night. The man whose wife reached over to wake him that morning, he had snored for 20 years. His wife told me afterward that the snoring had always been loud and irregular. There were pauses, silences that lasted a little too long, and then a gasp, and the snoring resumed. She had always thought it was just a nuisance. Nobody had ever explained to her that those pauses, those silences, were the sound of a man whose heart was being stressed hundreds of times every night. Nobody had ever told her that the gasping that broke the silence was the sound of a body in physiological crisis, over and over again, while he slept. Does your partner snore? Do you? Do you wake in the morning feeling unrefreshed, despite what feels like a full night of sleep? Do you have high blood pressure that seems resistant to your medications? These are not questions to set aside. These are questions to bring to your doctor at your very next appointment. A sleep study is a simple, non-invasive evaluation that can identify this condition and open the door to treatment that genuinely protects your heart. Please do not wait. Here is what I want you to sit with for a moment. None of the 5 habits I have described today are rare. They are not exotic risks that affect only a small number of unfortunate people. They are things that millions of older adults do every single night in bedrooms across this country without any awareness of what is happening inside their bodies while they sleep. The hours you spend unconscious are not neutral. They are either healing you or harming you. Your heart is either recovering or straining. Your blood is either flowing freely or slowly thickening toward a clot. And the choices you make in the 2 hours before you close your eyes determine which of those realities plays out overnight, every night, for the rest of your life. You now have knowledge that most people do not have, and knowledge, when acted on with care and intention, saves lives. So here is exactly what I want you to do tonight. 5 steps, achievable right now, and genuinely, meaningfully protective for your heart. Step 1. Have your last substantial meal no later than 6:30 in the evening. Keep the sodium low. Choose herbs and spices over salt, and avoid processed or cured foods in the evening hours. Give your digestive system and your blood pressure time to settle before your head hits the pillow. Step 2. Set your bedroom temperature between 60 and 67 degrees Fahrenheit before you go to sleep. If you run cold, use a light blanket rather than raising the room temperature. Let your core body temperature drop naturally. That drop is what triggers and sustains the deep, restorative sleep your heart depends on. Step 3. Stop consuming alcohol at least 3 hours before bedtime. If you enjoy a social drink, move it earlier in the evening and give your cardiovascular system adequate time to process it before your heart needs to enter its overnight repair cycle. Step 4. Drink a small glass of water, 4 to 6 ounces, immediately before you lie down for the night. Not a large amount, just enough to offset the mild dehydration your body carries from the day, and to protect your blood viscosity through those critical early morning hours between 3 and 6 a.m. Step 5. Sleep on your side, not on your back. Place a pillow behind your lower back tonight to prevent rolling over. And if anyone has ever told you that you snore heavily, particularly with pauses and gasping, please schedule an appointment with your doctor this week to discuss a sleep evaluation. Identifying and treating sleep apnea may be the single most powerful cardiovascular intervention available to you right now. And always speak with your physician before changing any prescribed medications or treatments. These steps are designed to complement your care, never to replace the relationship you have with the doctor who knows your full history. The man whose wife reached over to wake him that morning did not have to die that night. He simply did not know what you now know, and that matters more than I can express. I want to ask you one question before you go, and I genuinely want your answer in the comments below. Which of these 5 habits did you not realize was connected to your heart health? Was it the temperature of your bedroom? Was it the water before bed? Was it the sleep position? Tell me below. Your answer will help me understand what to cover next, and it may help someone else reading those comments recognize their own risk in time. If someone you love is over 60, please share this video with them. Not because I am asking for promotion, but because this information could genuinely change what happens to them tonight, in their bedroom, while the rest of the world is asleep. And if you want to know which common sleep aid, one that millions of older adults take every night without a second thought, has recently been linked to increased stroke risk in people over 65, that is exactly what I cover in my next video. You do not want to miss it. Take care of your heart tonight. I will see you in the next one.